Next, we'll talk about considerations for prescribing mood stabilizers and anti-epileptics in the geriatric population. So lithium is a medication that can be very effective for treatment as an augmentation strategy for depression, as well as for treating bipolar disorder. It's important to just monitor for response and potential side effects. With age, there are related reductions in renal clearance, and we need to be very cautious about checking blood levels and monitoring renal function for older adults. Additionally, there's decreased total body water, as well as medical comorbidities, such as dehydration, heart failure, hyponatremia, impaired renal function, that need to be considered. Also, potential drug-drug interactions, so thinking about whether patients are prescribed other medications that can reduce the clearance of lithium, such as thiazides or ACE inhibitors or nonsteroidals or NSAIDs. And it's important to watch for toxicity at normal or low doses. Older adults can be more sensitive to the central nervous system effects of lithium and experience side effects at lower lithium levels. Some people have hypothesized that might be due to increased permeability of the blood-brain barrier as we age. Valproic acid is a medication that has common side effects that include sedation, nausea, weight gain, and hand tremor. Some more concerning side effects would include thrombocytopenia, pancreatitis, and increased liver function tests. It's important to have monitoring not only of the blood levels of valproic acid, as well as to periodically monitor platelets, as well as liver function tests. In patients with low albumin, valproic acid binding is typically reduced to plasma proteins. Folks recommend using a free valproic acid level rather than a total. So just important to think about potentially checking that for older adults, especially those with low albumin. Other mood stabilizers that are used include lamotrigine, which is generally well-tolerated and can be used for bipolar depression. The severe side effect that we worry about with lamotrigine is Stevens-Johnson syndrome, so being very cautious and tapering up and going up on the dose of the medication. Also, valproic acid can increase lamotrigine concentrations, so just being very careful if you're using these medications together. Additionally, carbamazepine is a medication that can also be used as a mood stabilizer and can cause sedation, nausea, dizziness, as well as some other side effects, including agranulocytosis and hyponatremia. Carbamazepine has a lot of drug-drug interactions and actually auto-induces its own metabolism. When it's used with lamotrigine, it can actually reduce lamotrigine concentration. So always important to think about potential interactions when combining that medication with other classes. Gabapentinoids, such as pregabalin and gabapentin, are increasingly used off-label for sleep, anxiety, and behavioral disturbances in dementia. They also have an indication for neuropathic pain and seizures as well. And use of these types of medications has really increased 2 to 3 times in the past decade. However, this is really despite very limited randomized controlled trials that show evidence to demonstrate benefit. There are some side effects to be aware of: sedation, decreased clearance and renal impairment, as well as abuse potential are important to note with these medications. So key points for this section on mood stabilizers. So lithium is safe in older adults. However, it's important to watch for dehydration, drug interactions, and toxicity at even normal or low doses, especially among patients with renal impairment. Gabapentinoids are increasingly prescribed off-label for sleep, anxiety, and behavioral disturbances in dementia, despite limited randomized controlled trial evidence to support use.